Does the fact of shaving of hair or trimming of hair in hair transplant scare you? Are you hesitating to do a hair transplant just because you've heard that in hair transplant you have to shave your head, trim your head, wear a cap for 3 to 4 weeks and sometimes for months, and you are in a job or in a business where you just can't afford to shave your head? The first of its kind video that I have made on long hair transplant. This is going to be a long, detailed video, and if you think that you can actually do a hair transplant without cutting a single hair, and you can be back at work, in office, meeting people, meeting your clients, meeting family just within 3 days, and no one comes to know, then you're right. There is a technique. Lots of details of long hair transplant that will convince you that this is the technique, that is the state of the art technique in hair transplant. And it will help you realize that the 30,000-40,000 rupee transplants which are happening everywhere, literally in every corner of every lane, every city, which is being done by technicians and non-qualified doctors, is not the one for you. So if you think that there's a value that you can give to yourself and you don't belong to that 30,000-40,000 category of hair transplant, and you want a treatment that is premium, that does not cut a single hair, gives you a perfect look right from day 3, and no one ever comes to know that you've done a hair transplant, then this is a video you just cannot miss. You have to watch this, because there are very few videos on long hair transplant that are going to describe this technique in so much detail. And maybe the hair transplant that you've been procrastinating for years is just because you didn't know too much about it, and this will help you take the correct decision. So let's start. Long hair transplant, as the word tells you, is long hair. We take long hair roots as long as this, 1, 2, maybe even 3 inches long. We can do that. We don't cut any hair at all. We don't shave any hair. We don't trim any hair. We take hair from the donor segment and implant it one by one. I'm going to show you each step of the long hair transplant process today. And in this video, this is specifically for a patient who's done a previous transplant in some other center. The center told him that they've done about 2,500 grafts, and they made a bit of the hairline portion. It's very scanty. The hairline is very poorly done, very bad design, very low density. So the patient was very unhappy, wanted a proper technique, but his condition was that because he has to join a new job, he cannot appear shaved. And so he was willing to pay the premium of a long hair transplant, because that gave him an opportunity to look absolutely normal as he goes to his new office the next week. So we initial first step is to do the marking. We first identify all the areas that new hair has to be implanted. We can actually do long hair transplant within existing hair. So if you've got lower density, then you can actually do a long hair transplant within existing. Second step is to define the donor segment. This is a difficult part because we are not cutting any hair, we're not trimming any hair, and we have to define the donor segment correctly. We can do up to 8 to 10,000 hair follicles with long hair transplant and unshaven FUE technique if the hair is reasonably long. Otherwise, we can do about 7,500 hair follicles if the hair is not very long. And just for perspective, 7,500 with a hairline we can cover till here, and 10,000 we can cover till about here. Now, once this process is done, then the actual hair transplant surgery starts. The first step is to take out a portion of the hair. We perform the FUT technique, and it is very difficult because to take out the hair strip with long hair is a tough task. A normal process of strip removal takes about 20 minutes. Here it can take 40 to 45 minutes. And everything has to be done by a plastic surgeon. And that is why you do not hear too much about long hair transplant, because today dermatologists, Ayurved specialists, homeopaths, MBBS doctors, technicians, engineers, ice cream owners, literally anybody on earth is doing hair transplant by just calling few technicians to do your hair transplant. I don't know if you really want to do yours at those places, but long hair transplant is only done by plastic surgeons, and therefore very few people globally do hair transplant, long hair transplant. Long hair transplant requires a large team. As you can see, there are about 12 people working at the same time on the same patient in order to create success. So it's a long process. It's a difficult process. Requires a well-trained, large team, and it just cannot be done by anyone on earth. So the training is long. We have to individually hand train each assistant. We have to hand train our own doctors in order to perform a long hair transplant. So once the strip is taken out, we perform stitches. The stitches are done in such a way that it leaves the barest of lines. You can barely see any scar at all once it heals up. And then each strip is then cut down into small slivers, very small segments, which carry a row of grafts. Then each sliver is separated into its individual grafts. And once that individual graft is separated, you can actually see each graft has each a long hair on it. It's a very long hair shaft, and separating each graft can take a lot of time. So what we need is a lot of patience, a lot of training, and each assistant has to be perfect. You cannot afford to mess up and damage the hair roots there. So separation of the hair and then keeping them wet in a cold environment is key, otherwise they die out. Next step is the most important step. It is the most difficult and the most important step, and that is to create spaces within the existing hair. So you need to make sure we don't damage any hair, creating the space in such a way that we don't miss any segment. Because if the hair is there and you have to implant in between, it can take a very long time, because you have to make sure you don't damage anything. And it can take me nearly more than an hour to create just about 2000 to 2500 graft spaces. So that's how long it takes, and this particular step has to be done by a plastic surgeon again. So therefore all those small clinics just cannot perform long hair transplant. Finally, the last step of hair transplant is to individually implant each long hair into each space within the existing hair, and that is tough. Believe me, it's a tough process. Implantation takes at least 200% more time compared to a normal shaved off hair transplant, which is very easy. Trust me, FUE or any of these other procedures, DHI, BioFUE, they are simple procedures. They're not too demanding at all. The only key thing in all these procedures is correct designing. In a long hair transplant, each step is difficult. To take out the hair is difficult, to separate the hair is difficult, to make spaces is difficult, to implant is difficult. And that is why a long hair transplant is a very premium service and is not for everyone. So you have to appreciate that a long hair transplant makes sense only if you do not want that appearance that you've done a hair transplant. You don't want people to know that you've done a hair transplant. Now, long hair transplant gives the same results as any other transplant, and by the end of the year, you're all full. In fact, at the end of 7 to 10 days, you get such a beautiful appearance of literally full density, and you feel really happy that this is the kind of result you're going to get. At the end of the year, you've got a complete hair transplant look, almost no complications, almost no downtime at all. Third day back in office, I had a captain from one of the leading airlines, and he was able to fly on day 4 without anyone knowing, without his aerostresses, without his co-pilot knowing that he had done a hair transplant. I had a senior counsel of the Supreme Court undergoing a hair transplant, and fourth day he was in the court, and no one came to know that he has done a long hair transplant. In fact, today most doctors are opting for long hair transplant. We've had CEOs of companies opting for long hair transplant because they know that they just cannot shave. So move away from that shaving concept. Move away from that concept where you have to trim, shave, wear caps, hide from the public, and embrace the concept of a long hair transplant. This is the best and the most sort of socially acceptable technique of hair transplant. Some of the common mistakes which people make when they're taking out the strip are: one, they take too deep. They cut too deep, which causes a lot of bleeding and it causes nerve damage. So you have to be very careful in that. So you have to select a good plastic surgeon. When you're putting stitches, if the stitches are done too deep, they're not done properly, they're done too tight, then it leaves a bad scar. And if it's just perfect, the scar is virtually invisible. So that is the key thing during stitching that you have to take care of. What are the problems that can happen when we are separating the hair? Now see, this is long hair, so the hair keeps coming in the way. So you have to be very slow, patient. Make sure that the roots are clearly seen and you do not cut the root. Today, because the technicians who come on the hire and they reach different clinics, the same technician operating at 10 different clinics, they do not know how to separate FUT grafts. They end up damaging all the grafts, so you get poor results, and that is why you don't hear of long hair transplant. The problems that can happen in spacing, that is the key step, which I've always said is a key step, is that the angle of the space. So you've got some hair already there. If the angle of that space is not parallel to the existing hair, you will damage the existing hair. So it has to be exact, right in the same direction, same angle. And that is tough. Then you have to achieve good density. So you might need to make some small spaces within the existing hair in order to get single follicle grafts. You might not have space for a large graft. So that has to be, that is common sense and intelligence at play. So experience plays a very, very major role in these things. With FUE graft, sometimes in the hairline, you get a lot of cobblestone. Now, our patient who we are doing the procedure for today had a lot of cobblestones, fine, fine cobblestones all along. And that is a telltale sign of a bad hair transplant. So, particularly happens in FUE. And why? Because in FUE, if you do not process the hair root, you do not take out the extra skin, you'll have mountains visible on the top of your head. And if you choose 3 to 4 follicle grafts for the hairline, you'll definitely get cobblestoning. So you must not have cobblestoning. And therefore, FUT plays a better role by avoiding cobblestoning. In fact, I can go ahead and say 100% of FUT grafts will never cause any cobblestoning at all, and you're more likely to get a cobblestone with FUE. When I say that you can actually get back to office on the third day, you might ask me, what is the proof? Proof is here. You can see the person right before his procedure, the same patient 3 days after. Now, would you not like such a look that 3 or 4 days after the procedure, you get a full complete look? I really don't understand why anybody who's in an important position in life can afford to shave his head and not choose FUT long hair transplant technique and get this perfect.